Throughout nursing school, students undergo clinical rotations to apply theoretical knowledge, enhancing the quality of patient care and their knowledge, skills, and attitudes. During the third year of nursing school, students are exposed to psychiatric facilities with patients undergoing mental health treatments. Experience-based teaching in these settings is critical in fostering favorable attitudes towards mental health nursing. Good day! We are Group 3A of BIN 3A. I am RHEA MANALO, and together with me are KATHREEN MAGPANTAY, Angel MAPA, CARLOZ MARAVILLA, and Chelsea MAYMIERO. And today, we're going to present our nursing research entitled Exploring the Journey, Live Experience of Nursing Students During Psychiatric Nursing Exposure. For the purpose of this study, it has been found that exposure to psychiatric nursing profoundly influences student nurses' capabilities and perspectives, enhancing their ability to deliver high-quality care to mentally challenged patients. Hence, the study addresses pertinent challenges and contributes vital insights to psychiatric nursing. This study aims to explore the journey of the lived experience of nursing students during psychiatric nursing exposure.
The researchers utilized a qualitative research design centered on a phenomenological approach to address the objective of the study. The study's results were obtained through in-depth interviews with individuals possessing first-hand experience of the subject matter. It involved detailed and open-ended conversations with participants to gain profound insights into their experiences, perceptions, and perspectives.
For the participants, the study utilized the non-probability purposive sampling method. For the participants of the study were the selected 7 Level 4 nursing students, 1 student per section, and had exposure to varied psychiatric conditions or diagnoses like schizophrenia, dissociative identity disorder, bipolar with manic and depressive tendencies, undifferentiated schizophrenia with sexually connotated behaviors, and substance abuse or addiction. The inclusion criteria were as follows. Students underwent exposure to at least 2 facilities, either male or female, handled at least 1 patient, enrolled in the summer course NCM 117 of the school year 2022 to 2023, and completed the 3-day exposure.
For the research instrument, to obtain pertinent information and gather the needed data, our researcher-made interview guide was used. The interview consisted of open-ended questions allowing the participants to express their subjective thoughts and feelings. The interview's initial section consisted of queries to learn more about the participants' profiles. The second part explored the main question regarding the subject matter, and lastly, the third part included additional and probing questions.
For the study's results, 6 main themes were identified. Theme 1 highlighted the participants' preparations before psychiatric nursing exposure. They said that these preparations effectively prepared and assisted them during their exposure. The sub-themes were 1A, comprehensive lecture and discussion on different psychiatric disorders, therapeutic communication techniques, and patient interaction, along with interactive role-playing and simulations. And lastly, the introspective self-awareness assessments, including the Johari window and self-awareness test, which helped them remain grounded in reality.
For Theme 2, emotional anticipation before the psychiatric nursing exposure, revealed diverse emotional anticipations. The sub-themes were the following: excitement, next is ambivalence, and lastly nervousness, which were influenced by various factors such as stigma and personal issues and perceptions as stated by the participants.
Theme 3, activities and tasks during psychiatric nursing exposure. The sub-themes were reflective journaling to express their feelings and experiences, and daily activity planning and interaction documentation, including transcribing interactions which were done daily. They also implemented ameliorative occupational therapies aimed at promoting a sense of normalcy, empowerment, and skill development among the patients. Theme 4 revealed participants' feelings during psychiatric nursing exposure with sub-themes namely empathetic, tiring, and hesitant and cautious. Upon seeing and experiencing handling the patients, most of them were able to empathize. Yet, due to various tasks needed to be accomplished daily, some of them described their experiences as tiring. Lastly, some expressed being hesitant and cautious as they were challenged by the complexity of the conditions of their patients.
For Theme 5, it showed the challenges faced during psychiatric nursing exposure. These challenges encompass communicative difficulties in patient interactions due to the patient's current condition and diagnosis, reality orientation and therapeutic techniques, involving careful use of words to avoid triggering patients and assisting them in returning to reality, financial constraints, and adapting to safety measures, especially during the culminating activity. And lastly, for Theme 6, we have reflections and insights. This included recognizing the importance of collaborative patient care with 2 student nurses assigned to 1 patient, and the effectiveness of post-exposure debriefing. They emphasized that face-to-face sessions would have been more beneficial than online sessions. Participants described their exposure as challenging and highlighted the significance of being physically and mentally prepared beforehand. Lastly, all participants demonstrated increased mental health awareness and reduced stigmatization.
In conclusion, the journey of nursing students in psychiatric nursing exposure highlights transformative experiences, including emotional anticipation, hands-on learning, challenges, increased awareness of mental health, and reducing the stigma. This study underscores the pivotal role of psychiatric nursing exposure in shaping future healthcare professionals' attitudes and practices, stressing the need for ongoing improvements in education and care delivery.
For our recommendations, we would like to suggest the following. To mental health care facility administrators to prioritize collaboration with nursing students, provide effective healthcare services for psychiatric patients, and develop programs to enhance nurse-patient interactions. To College of Nursing Administrators and Faculty, to implement improved learning strategies to expand exposure to various facilities, and to prioritize face-to-face debriefing for students post-exposure. To nursing students, to emphasize preparedness, therapeutic communication skills, seeking support, and tailored interventions to enhance performance in psychiatric nursing settings. To parents, to communicate with and provide emotional support to nursing students post-exposure to psychiatric nursing. To the community, to promote mental health awareness, dispel misconceptions, and encourage empathy and compassion towards mentally challenged individuals. And to future researchers, to explore a variety of complex mental health cases, increase the number of participants, differentiate nursing management based on diagnosis, and address inequitable access to mental health services. Once again, this is Group 3A of BN3A. Thank you all for watching.